So then what do you prefer when it comes to lipo technologies and why?
Good question. I bought the Smart Lipo machine when it first came out. I was the first plastic surgeon in California to purchase the Smart Lipo. So I've had it since 1996, quite a number of years. After the third or fourth case, what I realized is that it doesn't really melt fat the way that the media portrays it. It doesn't really turn the fat into a milkshake that can be easily removed with a liposuction tool. In fact, what I discovered is that it really melts fat at a very slow pace. And it did nothing really but slow down the operation and not enhance it very much. Until I really discovered that this heat as a byproduct could be very controlled. And that heat can result in a tighter, smoother skin. So that you're shrinking the wrapping after you remove the fat that's in the particular pocket. The other side benefit, and I'm not sure exactly why this is, we know it doesn't harm nerves, and nerves are surrounded in a sheath like an insulation on wire that's made of fat or lipid. And there have been a lot of studies to show that that fat is not injured by the laser. But what it does do is it seems like people have less discomfort after I add the laser to the liposuction. The laser itself also coagulates little tiny capillaries that are in the area that may ooze after the surgery for a period of a few minutes to an hour or so. And so therefore people have very little, if in fact any, bruising after liposuction when I add the laser to the combination. So essentially what I've done is develop my own technique, which now many doctors around the country are also doing the same thing. And that is to remove the fat with regular liposuction or with the tube. I have a little device on the liposuction cannula that makes it like power steering. So it makes it move a little faster, and I can use it more gently, almost like a violin bow, instead of the videos that you've seen where there's a lot of pushing and shoving and all that. This really moves very smoothly through the tissue, and it really gives me a good sense of feeling about fat that's there, or when I've reached the end and there's no more fat to extract. But I follow that with the laser at the end rather than the beginning. And the laser has a thermometer on the very tip of it. So if the temperature gets too warm, the machine will turn off and it will stop delivering the energy. It makes it about in degrees centigrade, 45 degrees centigrade, which is like a very warm jacuzzi. And so what that does, that contact with that heat for a very short period of time causes the skin to shrink, and it can shrink as much as 20 to 30%, which is an incredible amount. Regular liposuction will not result in shrinking of the skin to any degree. Ultrasonic lipo may or may not. It's not really been shown to shrink the skin very much. But there are several really good papers out that show that laser added to the liposuction at the end of the case will result in significant shrinking of the skin. And who couldn't benefit from that?